So I just moved to Boulder for Rolf in practice. So I went to school here, and then I liked it so much. I liked the sunshine and the accessibility of trails and the community that I decided to move and set up a practice here. Came to Rolfing because I broke my back, kind of in the thoracic vertebrae. I fractured it in half, but it stayed together. So I broke an area like behind, like my back in this area. And so you can imagine if you're running or biking or anything like that, if you can't move through here, you just do this, and then you start to have this really weird movement pattern. So I came to Rolfing, and I remember the first session I got up and I was like, I haven't breathed like that in like years. Like, that's amazing. As a Rolfer, Rolf movement is definitely something I want to like incorporate more, just because I see the value. And then there's also kind of like the selfish aspect. Like, there's still some kinks that I'd like to iron out.
And just tell me a little bit how it feels different from last time.
I feel like a length through here, almost like this area of my spine is like guiding me going this way. Instead of being like down, I have like this weird sense of lift that I didn't have before.
Weird sense of
it's
lift is one of our things for Rolfing here.
Yeah.
So he's had one session, and he's talking about that. So I'm interested in what's happening right here. Would you be okay to tuck your shirt in so
Sure.
you can see?
I would say there's definitely a lot more sensation through there as well. I just feel this area, and like movement is happening in this section as I walk. It's slightly uncomfortable in the sense that it feels like there's some things that haven't moved in a while that are being asked to move in a way that they don't necessarily want to.
Yeah. Well, I want to talk to them a little bit more. So what I'm seeing, just stop for a sec, what I'm seeing is that you are moving more through here but your sacrum is still pretty quiet. So this part, if you walk again, I'm just going to hold it. Can you feel how you sort of move around that? You're going from, your pelvis is going around it. And ideally, we'd like to see that moving with you. So let me just watch you one more time. So just kind of check in on that feeling again. A little bit pulling to the side.
I can feel that.
Yeah. And then walk one more time. But this is moving better since our last session.
I feel more upright.
Yeah, there's more fluidity through there also. That's nice to see. Okay, so because you're pretty deep front to back through your chest, when you lie down, your head drops, your ear drops below your coronal midline. And so you get a little bit of this going. Does that feel more comfortable to you now? Okay. So I just want to check in on your breath and see how it's moving today. And how about some head response? Remember that?
That's something that was a challenge to work on at home.
Tell me more about that.
For one, it just kind of feels weird to like lay on your bed or floor like this without a pillow or anything
and wiggle your head around.
Yeah.
Well, it's okay. But how does it feel when you do move your head around?
It's easier.
Besides your self-image being a little bizarre. Yeah.
There's a little more coordination, I think, through here, and I was definitely more aware of it.
Yeah.
I noticed I was holding on to it as I was trying to breathe before, and so I just kind of let it go while I was walking and running and all of those things.
Right. And so did you work with the micro movements in your throat here?
I tried to do the lizard throat.
Lizard throat, yeah. So he has had some serious trauma to his jaw and smashed his jaw up when he was a little kid pretty badly. Yeah. So let me just see the micro movements for the jaw and the neck again. Yeah. And the lizard throat, how's that going? Yeah.
That one's hard.
Yeah, I can see that. It just, well, but this, you're doing more with it than you were last time I saw it. That's good. Yeah. Mhm. Okay. And how's this place feeling that was so still last time? Is that, it's looking like it's moving better.
It feels like I unfolded it like inside out. It was kind of, this went down really far, and now it feels like it's able to come up and move.
Yeah, I'm seeing more movement through here. Good work, good work. Yeah, just keep playing with those things. So what I want to move on to today is your pelvis and your legs. I'm going to sit beside you here for a minute. I'm going to have you bring your knee up. And I want to work a little bit with micro movements in your hip joint. So I'm just going to take your weight of your leg on my shoulder and I want to bring your thigh to vertical. Okay. Stick. Boy, you're really hanging on there. Can you let me get your wrist. Your leg is heavy. We'll get it lighter. So see if you can let go enough. Feel how this rectus femoris tendon is really hanging on. See if you can let your leg rest into my shoulder and let that tendon go. That's it. Good. Okay. Get a better grip here. So now see if you can keep that soft. Let go. Yeah, good. So what I'm going to do is I'm just going to jiggle your hip around the head of your femur and the acetabulum. Okay. And I'm just looking for places where it's a little bit catchy, like right there. Can you feel that? Mm-hmm. Okay. And so one of the ways that we work with micro movements is to just, if we have a glitchy place, I just come up to it, just touch it, and then sneak around and come up to it from the other side. And touch it there. Yeah. That's good. So I'm just kind of nudging that place. Feel how over here you're moving more easily. And then right in here you get a little glitchy, but it's getting better. What's it feel like over there when I move the leg into that a little bit more medial place?
It's not uncomfortable, but it definitely feels like someplace that it hasn't gone to a lot.
Yeah, it's unfamiliar. Mm-hmm. Mm-hmm. Okay, I'm going to just set this down now. And you bring your other leg up also. And just see if you just compare your two hips right now. Tell me how they feel.
This one feels like it's cinched up, like right here.
Mm-hmm.
And this one feels like just longer through here, and like it lays on the table.
Right. So what I felt when I first picked your leg up was that you have a pretty strong habit of using your quadriceps for hip flexion. Mm-hmm. So you're like, that rectus femoris tendon was like, doing. And when you let it go, that let this whole place in the front of your groin open. Mm-hmm. And so one of the things we're really paying attention to here is getting this space open so your pelvis can come even more horizontal. It's one of the big, as you know, the big things in Ida's vision of what she called the normal body so the pelvis is horizontal. And when you were talking to me about how you were leaning forward all the time, I tend to keep this short, and it's really hard to swing the pelvis through. Yeah. Okay, coming over to the other side now. And your legs feel heavier than they need to. So bring this one up. Yeah, I think we can get them moving a little later. Okay, so your two hips may not feel at all the same. See if this one feels different to you. Right away, this tendon is being much more relaxed than it was on the right side. How do your two legs feel to you in terms of tension or function when you're running and stuff?
The left one seems a little more dysfunctional, maybe less organized.
Okay. Okay, now take your thought right to the head of the femur where it rotates in the acetabulum. And again, we're just looking for ease of movement. And on this side also, your medial side is a little bit more glitchy. Yeah? Does that feel true to you?
Mm-hmm.
Right there.
That has kind of like a, if I had to guess, like the psoas, like a sensation that runs similar to the psoas length when you move closer in like that.
Can you say a little more about that? What kind of sensation is it?
It's not nervy, but it definitely has this like charged, almost like electricity feeling to it. Like it.
So when you come in here, you get that charge?
And it runs up what feels like the psoas.
Runs up into your abdomen? Yeah, okay.
Kind of feels like when you lick a battery.
Okay. All right. Yeah. You okay with this? That's interesting. Softened a little bit now, huh? How is the nervy sensation?
It's dissipating.
Good. Okay, we're going to set it down now. How are you doing? How are the hips feeling compared to each other now?
They feel a lot more like they're both laying flat. This one still, there's sensation through here.
Yeah. Okay, so I want you to know how to do this for yourself. Okay, so with one hand here and then one on the inside, you're going to bring the thigh to vertical. Okay, and as you do that, try and keep this relaxed, because as soon as you extend here, you're going to activate your quads, and we want them right for this, okay? And then you can, play around with your hands to see where it's most comfortable. I like to hold mine pretty close to the joint when I play with this, but so when the joint is, when the thigh is vertical, that'll just put weight directly down into the joint, which will help it to relax. So now, explore it with on your own here, and just see. You're just doing the same kind of thing I did, but sometimes you may want to play in a circle at the very beginning and see where the tight places are, and then you just dance up to them from this side and just touch. Hello. Then don't force it, is what I say. Come around from the other side, sneak up on it, and touch it from that side. Sort of seduce it into letting go. So this is a very non-pressure kind of thing. Very relaxed. How's that feeling as you do it for yourself?
It's really cool. Yeah, I can kind of find some of the more interesting spots.
This was a lifesaver for me after I had a hip replacement, because after any surgery there's a certain amount of paralysis around the area, and this was
really good.
Yeah, it was very helpful to come back to life. Okay, so set it down now and see how that feels. And it looks like you got another level of letting go, because now this one's looking more relaxed. Yeah. Okay. So you want to do it for your right leg also? Just keep it vertical, so there's a temptation sometimes to take it too much toward your chest, but then you lose the weight of it coming directly down into the joint. How's that side feeling to you? I'm curious about this tendon. No, you're good. You're keeping it loose. Great.
This one, I feel like it doesn't really want to go medially. It doesn't want to go inward.
Yeah, that's what I found when I was working with it too. So coax that medial side. And then just set it down and see how it feels.
This just feels longer. Feels like this continues on for a while.
Right. So I call that the thigh jiggle, and I give that to you to practice. So I'd like to work now with your pelvic rock. So have you done one of those in class?
It's been a while.
Let me see what you do.
So one of the things we did was just kind of
Okay, good. Yeah, I like it that you're letting the knees shift away as you begin to do that. So just take it a little slower now. The knees shift out over the feet. See if you can angle them in a little more without strain. Is that possible? Yeah, okay. And then coming down, just letting your spine down again. So what I want to do is just refine this a little bit more. So what we're up to here is getting a unique axis of rotation for each of your lumbars so that they're not functioning as a block, as a lot of people will see that. But each one has, it's like the slats on a roll-top desk, you know what I mean? How they go blap, 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 blap. Or Venetian blinds, the same thing. Yeah, so the other thing we're up to is opening and stretching the lumbar fascia so that that whole part of your body starts to be more fluid. We're looking for fluidity through here. So I'm going to sit here beside you. This first time I want to just put my hand all the way up under you, if that's okay. If you'll just lift up a little and let me under there. Yeah. And I want to just get my finger on your spinous process of your first lumbar. And now just come on down and tilt your tail up so that this vertebra drops into the table. Okay. And then I'm going to just move my hand down and this vertebra drops in. Whoops. As that one drops in, see if you can keep the one above it still flattened to the table. I'm looking for length here. So let's come back to L1. Tilt your tail up so there's a vector between L1 and your tailbone. Okay? And then this one. And then you're going to keep this one down. And then I'm not able to keep my hand right under your spine the way I want to, but it's okay. I'm going to touch it from the top. So here's 4. Here's 3. Let that one down. And then letting down. Let your tailbone come down onto the table. Oops. Let go a little bit more, especially here. Yeah. Good. Now take a breath up to your neck and just do a few micro movements for your neck. So we're looking at getting the cervicals and the lumbars both mobile. And then the spine in between doesn't have a chance to stay rigid when those two parts are going. Okay, how did that feel to you?
That was really challenging at first, trying to bring my attention and awareness to that area.
Mm-hmm.
But yeah, as soon as I was able to lay all of that down, you're right, my entire spine feels really slack.
Mm-hmm. Mm-hmm. Does that feel good, the slack?
Mm-hmm.
Yeah.
Feels very comfortable right now.
Yeah, good. All right. Sometimes when I do this, I feel it all the way, and my neck lets go.
Yeah, like my head is resting really easily.
Mm-hmm.
It's awesome.
So let's try this again. So this time your hand. So take your hand and just rest the side of your little finger right against the top of your pubic bone. Yeah, and then you're going to initiate the movement there. So by pressing down there, it's like you take this curvy sacrum that you have and you tilt it. Okay? So press down there and let the tail float up. And the knees shift out toward the feet. Yeah. That's it. Until you feel your first lumbar on the table. Okay? And then, now let your other hand come here. So let's just kind of push down. See if you can feel your first lumbar through your belly. Yeah? Okay, and then now you let that one rest on the table and leave it there and let the next one down. And then you can just kind of walk down until you feel each one touching the table, and try and keep the ones above on the table. And if they start to pop forward, which can sometimes happen, my L3 likes to do that. So if one of them pops forward after you go below it, then just back up again and play with it a little micro movements around it and see if you can coax it into dropping back again. And then keep on coming down until all your lumbars are on the table. And then uncurl your sacrum. Yeah. And when you do that, you'll feel like you're stretching the front of your spine. Remember the anterior longitudinal ligament? Yeah. Okay. So just feel like you're stretching that.
That's a very, very interesting sensation.
Mm-hmm. Can you say more about what you're feeling?
It feels like anytime you stretch anything else, except this is like really, really deep inside, possibly in an area like you don't really feel often.
I can't quite hear you because I have these elderly ears.
It feels like I'm stretching this space inside that doesn't get a lot of attention or awareness.
Mm-hmm, mm-hmm. Okay. So take a breath again and play with your micro movements up there at the other end. So for you, I think the jaw and the throat are equally as important as the back of the neck. Yeah. So get all of that loosened up. try another pelvic rock now?
Sure.
So just take it. So when you first did it, you had the basic movement, but I want you to slow it way down now so you can feel everything that's happening, and be sure that as soon as you begin that the legs move out. So your femur is just like sliding out from the joint and the weight's shifting into your feet as you begin. That's it. Okay, a little bit more movement through the thigh. Yeah. And then slowly coming down. And feeling that stretching. And when you come to rest, then take your awareness back up to your neck and your head. So this is more like a meditation for the body. This is not about reps. Not how many you do, but how much you feel it. Yeah. And see if you can, when you get the movement happening in your neck, let it be even a little bigger in your neck. Just loosen all that up. And then just explore your breath and see how that feels. Good. So one more, and this time just really pay attention. The moment that you start, let the thighs really move. So that helps to open this area. Just letting it tilt. Yeah. Good. And then coming down one vertebra at a time. Very nice, Levi, you got that. Yeah.
I felt a lot more control
Yeah.
from deep within rather than using, say, these muscles or anything. I felt like I was controlling it from the center.
Yeah, well, this is about learning to move from core and having awareness of core so that we're not, as we say, putting a front on it out there in the world. Okay. Does that feel clear to you, how to work with it? So I would alternate it. When you work with it, just a pelvic rock and then 2 or 3 breaths, and working still with this enlivening this place, and micro movements for the neck, and this combination of breath and pelvic rock is very refreshing. When I used to do 6 clients a day and then a class in the evening, I'd catch it on my supper break. I'd be doing some of this to just refresh myself, to have energy for the evening. Okay, I'd like to see you walk again. So what are you feeling right here?
Just a lot more sensation.
Yeah, it's moving through now. Can you feel that?
I feel taller through there.
Yeah.
Like this just like stands up on its own.
Pardon me?
It stands up on its own. Like
Yeah, what I'm happy about is to see that your sacrum's beginning to rock through with your walking and you're not having to pull around it. Yeah. Nice. It's already, the more that you walk, the more you get in it.
yeah, I feel more connected to my feet too.
Yeah, no, this is grounding.
Yeah. And there is kind of like a dull ache on the inside.
Uh-huh.
I feel like that's just something's moved and
Right.
now it's being utilized
Are
more.
you familiar with the concept of the healing ache?
Yes.
When you've had something that you've been, the best example is when you've been working really hard all day and then you lie down in bed and you go, oh.
That's exactly how that feels.
So when something's been tense a long time and you let it go, it's just like, it can ache. Sometimes
I feel
it
like
can
I pulled out like a thorn or something, and now there's that leftover feeling of relief when you pull out like a splinter or a thorn.
Yeah, okay. So let's work with your psoas now. How about that?
I can do that.
Yeah. So I'm interested still in this fracture that you have up here, and getting as we get the psoas functioning, it's attaching right up there. Maybe not quite to T8, but close, coming up under there. And so I think that will help connect you through there so that you're getting more connection through. So back to the table, back to the drawing board. So when you do, this is the way that I do a fifth session when I'm doing structural work. What I'm going to show you right now. So it's like a way to integrate the movement into your structural work when you do a fifth session.
Cool.
Yeah, really. So what I'm going to do is it okay if I come in here and take hold of your psoas?
Yeah.
Okay. I'm going to ask you to think about lengthening. I'm just going to ask you for a tiny knee flexion. And I'm going to ask you to think about lengthening from your dorsal hinge, all the way down to the back of your knee, and start over again. When we really look for flexion that's open, we are thinking about the back side lengthening for this side rather than thinking about shortening here. We're lengthening here. So same thing here. We're going to lengthen from the back here, from the back top of your psoas, all the way down to the back of your knee, and then out of that lengthening, your knee's going to float up. Okay, you want to try that? A couple inches. Let this knee come up toward the ceiling. And I'm just wanting to see where your psoas is here. There it is. Okay. And again, just same thing. Thinking about this movement coming from the psoas. And come up a little further this time. And then down again. How you doing with that? Touch okay here? All right. Okay. So you're going to get long. And this time bring the knee up further and let the foot just trail. Keep coming up with the knee. Foot's trailing. And I'm going to have you bring your knee up and over to your chest. Yeah, good. And you want to keep the lower leg and foot completely relaxed because I'm trying to phase out your quads right now and have you use the psoas for that movement. Again, slide out. And rest a minute, take a breath. All right. So again, getting along and bringing the knee up. Foot trails. And now let the knee go straight toward the ceiling, like it's going to keep this relaxed. Yeah, straight up and over. And head it toward your eye. Yeah. And come back down. Okay. So one thing your knee wants to do is go over here. So remember the whole stuff about your cylinders. So think about this whole thing operating on the same cylinder with your eye. And so this time, as you bring it up, really see if you can, this is the same thing we're running into here. The medial, you're wanting to be pulled out. So I'm trying to get you to move into the inside line a little bit more here. So, you following me? Yeah. Okay, so as the knee comes up, you're just going to head it toward the eye. Here we go again. Lengthening. letting the foot tray out. There. Here's where you really run into trouble. And this is where this is grabbing like mad. Okay, so let me have the weight of your leg in my hand and let go here. And now what I'm going to do is passively bring your leg over. Don't let that quad tendon grab. Let go again. Yeah, there. And then down again. So what we're up to here is hip flexion from the psoas and phasing out the quads. So just take a look here for a minute. So when you're walking, at this moment, quads are functioning, okay, because your leg is straight and quads are knee extenders. At this moment in your cycle of steps, you want to let the quads relax and the psoas swing the leg through, okay? Then you put bare weight, and again, you're extending the leg and the quads are working. But every swing through, we want to have that happen from the psoas. And when that happens, you're getting a lengthening in the back. So put your hand on me here for a second. Okay, you can. So if I'm flexing my hip from my quads, this happens. Lumbars tend to catch it. Belly tightens, and this all shortens. When I flex from the psoas, feel how the upper spine, this upper part of the psoas drops back, the lumbars drop back, and the leg comes up. And also how much longer I stay. Quads, everything shortens. Psoas, everything lengthens, and the lift comes all the way through. Yeah, so that's what we're up to. Getting that to, so you have a very active quadriceps femoris here. So now I'm going to, again, bring your knee over. I want your body to feel that I can do this, that you can do this without tightening, even if I do it for you. So let go again. Let me have it. Yeah. Stay soft. Good. Feel what that's like to have that come over. And down. Take a breath. Let's do that again. That's it. That was good. No tendency to grab. One more time. Okay. How you doing?
Trying to map that in my brain.
Pardon?
Trying to map that in my brain.
Okay. And slide your leg out again. Okay. So coming back to your psoas. So now when you bring your leg up and over, you're going to just really attend to having the psoas do it and keep this soft. Okay. So what helps is a little bit of a pelvic rock, like what you just did. Let's have this knee up. This will help also. So when we're bringing the leg over and down, this creates a midpoint of balance. Okay. So let the knee come up now. And keep coming. Keep coming. Float it up and over. Don't go too slowly. Keep them come right along. Keep coming. Pretty good. Feel how much lighter that was that time?
Yeah, it was really easy.
Yeah. So the line of pull of the psoas is so much superior. So the quadriceps femoris is just one tendon on the very front, and it's picking up the other three quads too. And the psoas is attached right down here in this big, strong one muscle. And sometimes, have you ever tried to close the screen door when it was raining outside, and you do it from the inside and you try and squeeze the hinge?
I haven't, no.
Yeah, well, if you try and squeeze the door closed by squeezing the hinge, that's sort of like the quads. When you take the handle, you have a much better line of pull. Yeah, okay, so let's keep going with this. Now I'm going to have you take over. Find your own psoas. And if I were teaching this to someone who wasn't a Rolfer or a Rolfing student, I would just have them put their hand flat on their belly. rather than dig in, because that's a lot for someone who's not doing this. But you can find your own psoas. Okay. And then this hand is going to rest here, and you're just going to monitor the quadriceps femoris tendon there. So a slight rock, and then bring the knee up and over. Keep coming. Oops. Can you feel that?
Mm-hmm.
Yeah, so just rest in my hand now and let it go. And this may be a process of learning to do this. It took me a long time. I had a very active quads when I started to do this. Okay, and so we're coming over without that grabbing. And then turn it down again. No, don't reach with that foot, because what's going to happen? Hello. Yeah, all right. So let's try it again. Slide out. And again, you're heading your knee towards your eye as much as possible. And slight rock, initiate from the psoas. The knee comes up and over. Let's just do it a little more momentum. Yeah. And is this as far as you go?
I think so.
Well, let's try this. So this is hanging on again. Let me have it. Come on, that's it. There we go. Oops, you grabbed it again. Yeah, okay. Here we are. Yeah, I think you're going to find you have more flexibility this way when this isn't wadding up and making a bump in the middle of your hip joint. Okay. And then down again. Stretch both legs out now for a minute. And just rest your hand by your side. So now what I'm going to do is just shake your legs, okay? Just you be passive and just see where the movement goes now that we've waked up the psoas. And on this side we haven't. And can you feel the difference? Like the movement really kind of stops right here. And this side goes right on up. See if you can feel this movement flow up your front of your psoas all the way to your midsection. Yeah. How you doing?
That's good.
Yeah. Let's do your other side. So bring this knee up. Let's see how this one works. Okay. Roll your leg around so your knee's going to go straight toward the ceiling. And again, you're thinking lengthening from the dorsal hinge to the back of the knee. And bring the knee up. And keep coming. Keep coming. Yeah, this is easier, huh? Yeah, and down again. So you feel more difficulty with this leg, you said, but you have less tension here in the hip joint. Can you say more about the difficulty that you have in that leg?
I mean, it feels kind of like maybe this side gets overworked because it is a little more functional, maybe. I guess like I haven't really thought of it that way before. Yeah, but that was a lot easier that first try.
Yeah. We sort of noticed that when we were doing the thigh jiggle with this side. It was had more glitches in it. Okay, let's go again with the left. Sliding out. And now, a little bit of a rock, so you open the groin, and then bring the knee up and over. And the foot just follows. Head towards your eye. Yeah, good. And how far can you go now? This is still soft. You don't have a problem on this side. Yeah, okay, good. And then when you come down, just come down where you land, and then out again. Let me see. I think we already got it. Yeah, that one just came along really quickly. So I'd like to have you work with your own left side here for a minute. So the right knee is up, and your left hand is finding the psoas, and the right hand is here. So when I was talking about if you're doing it with someone that isn't a Rolfer, that when the psoas functions, the abdomen will fall back because the lumbars are dropping back that hole. So that's what they can feel. Okay, so find your psoas, and then check here. And rock a little and bring the knee up and over. Stay long. Lengthen. So you had a tendency there to bring your hip up before you started. Keep it long. Okay. And now bring it up and over. And then coming down, just you pretend you don't have a lower leg. Just wait till the foot hits the table. How's that feeling?
It's challenging, but I feel like I can feel the movement happening deep inside rather than right here. So it's that kind of like pulling of the muscle kind of feels like a string attached to my femur rather than like a knotting right here to pull my leg.
Right. So you can stay longer through the groin when you're functioning this way. Okay, one more time on your own. And this is an important part of the process of teaching movement, that you help someone at the beginning, and before you finish the session, they're doing it on your own so they can take it home with them. That's good. Just stay relaxed. How's that feeling that time?
It's more organized.
Okay, just rest a minute. Find your breath. I want you to just have a little time to absorb. So about this right side and the persistence of the quadriceps femoris, this is a process. So I would suggest that you practice it every day a little bit, and little by little this will come. I think if I'll see you again, so we'll check and be sure that you're working with it in a way that works for you. But I think you have the idea how to work with it, right? Just take a moment to feel. Here's the top of your psoas. And what I'm hoping is that this is creating more integration here with this. How does it feel around the injury place now?
It almost like I can't really notice it. It feels more fluid and doesn't feel kinked. Before it felt like it kind of had like a permanent. It has like more of like a desire to bounce and go up and down now.
Oh, okay, great.
So it's not as restricted.
Yeah, all right. So take a walk now. And just on the swing through, be very aware of your knee leading. Okay, so here, this is one of the things that I was really big on. When you start to walk, what happens? Your knee leads. Because if you start with your foot, you end up behind yourself. But if you start with your knee, then you can be right on top of your feet all the time you're walking, which is ideal, to be on top of your feet. So, and just feel the knee, so you're lengthening all the way from here to swing the knee through, just as we were doing on the table. Yeah. I'm coming with you now. I'm going to hold the top. So here's your this is how long your legs are now. Okay? And now walk from here. Let your legs swing out from here, just as we did. Lying down. Yeah. So you're getting much more of a swing through movement here in the pelvis. Let's see, turn around again. And just walk a little more quickly as if you were actually going somewhere. That's right. Can you feel how this is dropping down now? So what we're looking for is when we're walking that this movement happens on the swing through, and the side of the buttock drops down. Boom, boom. Yeah. Okay. So just be aware of that. Okay, so one thing that's happening, and this isn't strictly movement, but your sacrum's just a bit out on the side. I'm finished, I'll settle it for you. So we started just checking in on what you did last time, and I'm really encouraging you to work more, to loosen up that thing you had of the claw in your throat. Just play with the jaw and the lizard throat to see if you can keep softening that. It's looking a lot better. And I'm really pleased that you're moving through here now.
Mm-hmm.
Yeah, so today we started with the thigh jiggle. Okay, so you're lying on the table and moving that around. Remember, you want for the thigh to be vertical. And then just you're playing gently, not overriding, because then it will just create more tension. Just come up and nudge and invite more movement there. And I think more of that on the right side will also help you. And then we did thigh jiggle on both sides, and that feels clear to you how to work with it. And then we worked with a pelvic rock and getting each vertebra to let down separately. And this sense of lengthening and stretching in the front of your spine. Yeah?
Yeah.
Feel clear?
Yeah, I can feel that right now too as I'm sitting here.
Yeah, yeah.
There's a greater awareness.
And then we worked with the psoas. And really important when you're bringing the leg over that you don't extend your leg, or then you'll be very frustrated because your quadriceps will have to work. So that this comes over like the lower leg is just totally hanging. And you feel your psoas functioning, and that will help you to know what you're doing.
Mm-hmm.
And the other important cue is lengthening from the midsection. Does that all feel clear?
Mm-hmm.
So one hand here, one hand here. All right. I think we'll close here for today.
Good.